It's almost 3 months to the day that we started reducing our services to focus on the responding to the COVID pandemic. And I wanted to use this opportunity to update people on where we've got to now and how we're going to face the next phase of COVID-19. What we've seen is a big drop in the number of patients that are being treated in hospital, in our community and in our GP practices as a result of the pandemic. What we're now doing is starting to restart some of our services to bring people back into hospital, back into our community services and back into the GP practices to help us treat them. However, that is a big challenge for us as an organisation. The new rules around social distancing that we've all been observing over the past 3 months and other issues mean that in a typical day we will be able to see far fewer patients than we're able to before. So we're working through a very careful plan for how we can increase services over the weeks and months ahead. Whilst there's still a significant risk out there in the community, we have to manage COVID and non-COVID patients in a different way. Our sole focus is keeping patients, staff and visitors to our services as safe as possible and playing our part in reducing the risk of infection. Over the past 3 months, we've seen over 5,000 members of the public come through our doors with suspected or confirmed COVID-19. Those numbers are much more reduced now, so this enables us to free up capacity to focus on bringing some services back online. But what we know is things won't return to how they once were. We need to use the pandemic as a way that we can change services and change the way we provide care in a positive way, but we also need to make sure that we are focused absolutely on managing and being prepared for any future spikes in COVID activity. What this means is that for some of our outpatient activity, some of our outpatient appointments, these will transfer to virtual appointments, either over the phone or on things like FaceTime. It also means that some of the services that you traditionally come to hospital for might be moved into the community to make them more convenient and closer to home, and also so that we can spread out our services as best we can to maintain social distancing. But one of the things I want to get across is that I understand that during this period some patients are waiting longer for treatment, and I do apologise for that. We are working hard to get as many patients as we can to be seen, focusing on those that are urgent, but as we plan over the weeks and months ahead, our goal is to get more and more activity and more patients seen through the organisation, but it will take time. Over the past 3 months we've had to reduce visiting to the hospital to reduce the risk of the spread of infection. We're now in a position, following national guidance, where we need to release some of those restrictions, but we still need to make sure that only those people that need to come onto the hospital sites or in our GP practices are there. So only visit if you really need to. The key message here is that when you come on site, you will be expected to wear a face covering, and if you don't have one will be supplied with you, and it's really important that these are worn throughout the building during your time here. But also, if you are thinking of coming and visiting a family member on a ward, ring ahead, go on our website, call the ward and just check whether they're accepting visitors at that particular time. The key focus here is keeping you safe when you come onto our premises. I know that for many people, coming to hospital or going to their GP can be a nerve-wracking and sometimes anxiety-inducing experience. So I appreciate and apologise for all of the disruption that the pandemic has caused. We're not out of the woods, so we can't release all of the restrictions that were once in place, but we will work with you as best we can to make sure that we work through this next phase as safely as possible. Thank you for your ongoing support to your local hospital and to our 5,500 staff that work in the acute trust, in the community and in primary care. Your support and the spirit of Swindon is massively appreciated.